the role that I and my colleagues play in the project. I am Ann Robinson, and I'm a project management consultant at the Ohio Colleges of Medicine Government Resource Center, and we are housed at Ohio State. And so we help with administration and evaluation of the project. And so you might see us from time to time. And then we like to share the results of evaluations on a yearly basis. The goal of this evaluation is to understand the impact of the MedTap Ohio Systems of Care Project ECHO for youth involved with multiple systems, also often referred to as the SoC ECHO. And this is specifically for during the time of our state fiscal year, which is for 2023, which was July 2022 through June 2023. And as you may know, members of the learning community are regularly asked, as you have just been asked by Kara, to complete surveys on your experience participating in the SoC ECHO sessions. And so this feedback assists us in understanding how well the project is meeting the needs of participants and where there may be opportunities to make improvements. So the work today presented today is a result of a collaborative effort from our team at GRC, Emily Bailey, Paige Young, myself, Ann Robinson, and Heather Robinson, and our partners at NeoMed, in addition to all of you who provide valuable input by completing our project surveys. So thank you for that. And also thank you to our state sponsors who provide financial support and financial support and guidance to the project. It's ODM, Ohio Department of Medicaid, Department of Mental Health and Addiction Services. We are the administrators, and then we are also implementing the project in partnership with the Ohio Department of Developmental Disabilities. And just to let you know that the views expressed in the presentation are solely those of the authors and don't represent the views of the state or federal Medicaid programs. So we'll start with session attendance and engagement over the last year. We had a total of 43 sessions. Total session attendance of 1,475, and total unique or distinct participants attending sessions was 409. So that was our learning community. We had an average of 34 participants per session, which was a slight decrease from the year prior. This map of the state of Ohio shows the SoC ECHO session attendance by county, and this figure reflects attendance from 60 counties out of our 88 Ohio counties. The darker green represents larger numbers of session attendance, and so the highest attendance is shown from Franklin and Cuyahoga counties. 82% attended between 1 and 5 sessions over the course of the year, which was an increase from 79% in the previous year. So folks are able to attend more sessions. This chart shows that participants primarily identified themselves as being affiliated with the behavioral health, developmental disability, or FCFC wraparound systems of care. We post all videos of didactics on YouTube, as you may know, and didactic presentations are uploaded for public view. So this could be anyone accessing these links. This chart represents, or I'm sorry, this shows the 10 presentations that received the most views across the year. And these numbers give us an idea of public interest in particular topics, keeping in mind that some of the videos have been available for much less time based on when the session date occurred. So we see that Ohio Rise Mobile Response and Stabilization Services and intensive home-based treatment presentations received the most views, which shows continued interest from the community in learning more about the Ohio Rise program. That's similar to what we saw the year prior. Next, I'm going to talk about the results from the post-session survey, which is a link that's sent out directly after each session. We had 306 responses, which was a response rate of 22.8%. Survey respondents reported very high ratings for SoC ECHO sessions overall and across the systems of care. Majority of respondents reported that didactic presentations and case discussions were valuable to their work. And the figure here shows that over the course of the past 3 years, a majority of participants have also reported that sessions gave them new ideas to use with youth and families. So we have data from previous years that you can see here, and a lot of strongly agrees and agrees. Our case presentations, we had 39 cases presented and 17 counties were represented by those cases. This figure shows the case presentation by county, so you can see the darker orange counties are indicating that more case presentations came from those areas over the course of the year. You see our 17 counties, which was a decrease from 26 in the previous year, so they were a little bit more focused on these areas. And we see that a majority were from metropolitan and surrounding areas. The systems of care, this figure shows the system involvement demographics for cases. So there were 32 cases presented, which was a decrease from the previous 2 years. And that number is different because we have some cases that were presented that weren't submitted by a team, but rather a discussion. So we have 32 cases that were submitted by teams specifically, and they were centered on youth ages 5 to 18 years old with a range of 1 to 13 diagnoses per case reported. And the diagnoses were most often from the category of behavioral health. There was an increase in the total number of behavioral health diagnoses across cases from the previous year. And also most often the cases involved the behavioral or mental health, education, and FCFC systems of care. We look at key themes of the priority questions that were submitted by case presenters, including recommendations for evaluations, assessment, monitoring, treatment and medication options, behavior management strategies were the key themes from this past year. We look at the case presenter survey results. This is distributed to case presenters 3 months post their presentation, so we can get a handle on how they think it went, things we can do better, if they were able to implement recommendations. So we had 11 responses, which is a response rate of 50%. We see that this map displays the counties represented by the case presenter survey respondents. A star indicates each county with at least one case presenter response. And note that the presenters may reside in a different county than the individual addressed in the case discussion. And Stark County had the large number of responses from case presenters, followed by Hamilton County. The most highly rated beneficial aspects of presenting a case reported by survey respondents in 2023 were the availability of a broad variety of experts, the specific recommendations received, and the resources and links provided afterward. Our annual survey results, that is the survey that takes place in June. So you are receiving that request right now for this year. Out of last year in SFY 23, out of a possible 409 unique participants, we received 53 responses, which was a 13% response rate, a decrease from 16.4 on the previous year. So the responses came from 30 counties and were primarily from the Northeast area of the state. 58% of the respondents attended 5 or more sessions over the course of the year. Most respondents felt comfortable asking a question or providing a recommendation during the sessions, as shown in the figure. Respondents who reported that they did not feel comfortable asking a question or providing a recommendation reported that more experience in their role or greater familiarity with the ECHO process would have made them feel more comfortable. The majority of respondents report that they have applied lessons learned from the SoC ECHO to other complex cases in their practice. A majority also reported that they felt participation in the SoC ECHO sessions helped to plan or make changes in their practice in all areas. Here are some quotes that share that gaining new perspective and the support provided to agency partnerships are a few reported benefits of participation in sessions. respondents commented that the SoC ECHO had helped them make changes in improving community connections, increasing knowledge or ability to support education, seeking out new providers for the care team, and utilization of new resources as a result of their SoC ECHO participation. And one respondent shared that participation in sessions encouraged them to research topics more deeply and look into ways that they could bring professional development sessions to their community. So we see that folks are finding they get new perspective, and that it can help agency advocacy efforts and systems communications. Also, for our annual survey, case presenters specifically, we asked some questions about their experience. 26% of annual survey respondents presented a case in the past year. And of those survey respondents who responded to questions about the use of the recommendations, we see here about 86% reported using the recommendations provided by the SoC ECHO team, and 91% reported that the recommendations were either very or moderately effective in assisting their case. The two respondents who indicate that they had not used the recommendations reported that the parent was not willing to try the recommendations or that they were already in use. We also asked about the SoC ECHO online toolkit. Around 41% of annual respondents reported having visited the SoC ECHO online toolkit in 2023. And of those that visited the toolkit, around 94% responded that they had found items that were helpful to their work or practice. So key takeaways from the annual survey are that a majority of respondents continue to report that the SoC ECHO increased knowledge and skills for assisting youth and their families. Also, that a large majority of respondents felt empowered to ask a question or provide a recommendation, which reflects the respect and cooperation between learning community members that we see in sessions. So thank you for creating this environment where people feel comfortable contributing. And just some conclusions that we took from these data. We saw increases in the geographic spread and number of participants in 2023, but the median number of sessions that people attended increased. And many survey results across all surveys were positive and continue to show encouraging findings in learning, increases in learning and reported changes in clinical practice. Case presenter survey results showed high satisfaction with the elements of the ECHO process and reported recommendations to be effective in helping the case. But we are hearing that people do experience barriers in implementing the recommendations. A high proportion of early career annual survey respondents also indicates that the project is continuing to reach the target audience of professionals who are learning or newer to their roles, perhaps. We do see some opportunities to engage in outreach to new partners, continue to connect with Ohio Rise and to recruit potential case presenters from different areas, to continue to promote the online toolkit as a training resource, and to adjust the case presenter survey cadence, which we did in fact implement in the current year, so that we will give people a little bit more time after the presentation to implement recommendations and gather feedback. Now I'm going to give an update on the SoC ECHO online toolkit, which we do annually. I'll start with a little bit of background for those who are new to the toolkit and then share some information on what items are being added this month. So the SoC ECHO online toolkit launched in January of 2022, and the toolkit is intended to help the learning community to connect the dots on key themes in the management of complex cases that arise from the weekly case discussion, or bi-weekly, excuse me, that's a typo, case discussions and recommendations, as well as to share associated resources from the sessions for those who can't attend. Key themes from the ECHO recommendations and relevant resources were compiled to build the toolkit in 2022, and GRC conducts thematic analysis of those recommendations and posts updates to the site on an annual basis. So that is currently happening this month for this year. 80 case recommendation forms have been analyzed to date. So that's what's included. Oh, excuse me. You see at the bottom here, the GRC website, you can type in go.osu.edu/SoC ECHO Toolkit to get to the toolkit. And you can also access it through the Ohio Systems of Care website. There is a tools and resources page. So I also have it later on in the presentation in a shortened form. So we can add that to the chat. The status update for this year is that the latest thematic analysis was of recommendations from January through December of 2023, and no new themes emerge from the recommendations, indicating that we have a saturation of toolkit recommendations. And we also reviewed resource categories for inclusion. And so we will be reviewing the methodology for the next update in spring of 2025 to ensure that the emerging themes are captured and the inclusion criteria is appropriate. So as we get more recommendations, we want to make sure that we're including new things that come in from our case discussions, and if they reach if they're mentioned a certain number of times, that we make sure that they're included. You see this lovely graphic on the right-hand side that's also on our website. So thanks to Neomet and Jamie Brewer for creating that. It gives you an idea of the topics in the toolkit. And here are the links again to access the toolkit. Because we know that some learning community members are new, I'm just going to share some information about finding and using the toolkit. You can use these toolkit topic buttons that are at the bottom of each page to navigate throughout the site and not needing to go through the home page. So you see that we have recommendations and resources arranged into the areas of evaluation, assessment, therapy intervention, education resources, youth support, family caregiver support, cultural resources, and team support and resource areas. In practice, we would say that our target audience would be anyone who works or provides services to youth with complex needs and the family members of these youth. So we like to supply items submitted by the SoC ECHO community that are not specific to one youth or family, that could be generally regarded as some things to look into or try, or ways to find more information about a specific topic. We do not provide specific medical recommendations. And the resource links are primarily links to publicly available online resources and trainings. Book recommendations have links to read more about where or how to access that material. And because our learning community is diverse and perform many roles again across multiple systems of care, we thought it might be helpful to highlight how the recommendations and resources may be helpful to all involved. So here are some examples of items from the toolkit sections and a few key SoC ECHO affiliated user roles to show how toolkit recommendations may be beneficial to each. So we know that we have an opportunity to reach care coordinators, clinical providers, parents, and caregivers, and that we often talk to these folks in sessions. And so you see that maybe occupational therapy and sensory differences, information on those types of evaluations might be applicable to everyone. Maybe a substance use disorder screening tool would be more appropriate for clinical providers, but you see that there are a number of things that kind of cross audiences. And so that's really the goal of the toolkit, is just to give anyone who's working with youth information about how to follow up on any of the items they hear in sessions, or check in on what the learning community has recommended. So I want to thank you, and if there are any questions, let me know. I am also going to put the link to the toolkit in the chat, and I'm available to answer questions offline as well. But we hope that folks will take a look and give us their feedback as part of the annual survey. We really want this to be a resource for people, that could be a free, enduring resource. And we hope to continue to build and grow that list as we go along.